guys are not alone. And at end, I'm teaching family to family how to deal with the mental ill crisis. And one of the things that I always emphasize to everybody over and over again, the police officers are not there to solve your problems. You need to call them in the very last moment. So don't wait until it's a crisis. Whenever it's you see a crisis coming in, do something. Take them to the hospital. Ask for some help. But and I am very specific about what to tell you, what not to tell you. To wait outside of the house. Otherwise, you guys will have two crises, the mental ill and the family screaming as well. So in our end, we are teaching the parents, of course, whenever there's a crisis, they forget about everything. But we try to emphasize over and over and over, the police officers are not going to solve your problem. They are there in the very last moment. I just want you to know you are not alone.
And that's one of the things that I see whenever I talk to people in the community. That's one of their questions is they call wanting a particular response. And there's not too many options when law enforcement's called. So we are kind of like the last effort, and we try to get them to reach out to other organizations and things ahead of time. Before it ever gets to a crisis level. So I know for here in McKinney, we totally understand that. And that's one thing that we look at, all the time, is just trying to educate the community to let them know what's out there and what's in the community and what can help them ahead of time.
Definitely, yeah. Chief Drain, I'm besides being a Garland police officer, and my boss is on this Zoom meeting with us, I'm also on the NAMI North Texas Board of Directors. We're real appreciative of your time to engage with us. NAMI North Texas and the Board of Directors and our Executive Director, Dr. Trenton, our goal is to be better partners to you guys and the residents you serve with our no-cost programs. And one of the questions that we were just presenting to the other panelists was, what do you see as law enforcement's role in addressing mental health and homeless issues, problems in your community? That's what kind of when you came in, we were just talking about that.
Okay. Well, I think it's ironic you mentioned that. I was reading this morning how San Francisco is moving moving to a non-law enforcement model to responding to homelessness and some mental health calls with fire paramedics and counselors and some others instead of law enforcement. It's about 25% of San Francisco PD's calls, and that's going to be about roughly the same for us. We need to do a better job of data tracking, and we just put some things in place in our CAD to hopefully do that better right now. But that's a lot of calls, and one of the reasons people call police to those calls is because there's only one number to call, 911, and we get there relatively quickly. And so so the bottom line is, I think we're going to continue to see police have a big role in that. We've got an issue right now. Our city hall is limited. It's open on a limited basis, so the doors are open. We've got some homeless folks going in there and sleeping, and so we were just having this conversation with my deputy chief this morning. That the staff needs to call 911. So we've got neighborhood services. They've just hired, beginning at this fiscal year, and I think they've got the person selected. They've got a homeless coordinator, and they said, hey, once we get this person all on board, we can let them come over and handle those calls at City Hall if they are not dangerous. But and we will gladly let them do that at the police department. But the thing is, though, is dispatch, they can't call a cell phone number and not get an answer when they've got somebody waiting over there. So the bottom line answer is, it's good to see others moving towards that model, but I think it's going to be a while before we have enough infrastructure to move police out of that. And then the other issue we have too is some of the calls, dispatch can probably pretty quickly determine that the person is nonviolent or it's not dangerous, it's not criminal, but you can't always do that. And so, so I think the police are still going to be involved in quite a lot of them.
Yeah, I definitely agree with that. That's a really an assessment that in NAMI North Texas, we see the same thing. It's something that we're definitely all seeing. I definitely agree with that assessment.
Yeah, you know, one of the things that we were doing in Amarillo before I came, we had a co-responder model. I think it was House Bill 13 that passed in the Texas legislature about 3 or 4 years ago. It allowed us to apply for some grant funds. We were able to hire 2 counselors. We called them intercept teams. So we had a mental health homeless team, 4 to 6 officers at any given time. They were authorized 6. And then we put them in the car together. So we had, you know, one counselor and a cop, and one counselor and a cop, Monday through Fridays, you know, one on day shift, one on evening shift, to try to respond to some. Obviously, they're not going to be able to cover all of your mental health calls because you just get too many. But on some of the hardcore calls they would go on, they would help do some of the follow-up things, and it worked pretty good. And we've got a grant in to try to do a similar thing here, a DOJ grant this time. So we'll see if we're able to make that happen with our Behavioral Health Authority LifePath systems.
Awesome. Hey, Terry, is there anything McKinney that you'd like to add that you guys are doing there? Or?
No, there's not really anything any different than anybody else is doing. So, I mean, we're pretty much on the same level that everybody else is doing. Our challenges are getting buy-in. I mean, in order for any system to work, you got to have law enforcement, the community, the hospitals, just everybody needs to buy in to the system, and that's a constant challenge right there.
So Chief Dixon, one of the things that we're doing here is we want to partner with you guys at a higher level and a much more meaningful level for your residents that you serve. When you're heading into this foray, who do you find that you can partner with where you're not just going it alone, when you're going to be trying to work with persons that are homeless, and maybe there's even a mental health component there? Who are you able to partner with out there where they're actually of value and help you guys out, where you're not just alone?
Now, I think our biggest proponents here locally, United Way of Denton County and MHMR here in Denton County as well. They've both been tremendous partners. What I think NAMI can do to make it a game changer is bring in some of that technical expertise, because it's a different name that people aren't accustomed to hearing here locally in Denton County, as well as bringing in some training for both the police department and the community to help both better understand exactly what goes into it. Because speaking to what Chief Drain said, it's great for places like San Francisco to be trying to move to a model like that. We can't do that haphazardly. In the conversations that we're hearing around the nation right now, to summarily remove police from responding, that's not good for anybody. It's not good for the consumer. It's not good for those counselors that are going out by themselves. And it's definitely not good for us in law enforcement, because it's going to set us up to be responding on the back end to a much more dramatic call when someone is currently being injured or worse. And now we're going there solely for a law enforcement purpose, and we're not focused on what we need to be, and that's the consumer.
Definitely. Definitely. Chief Bryan, is there anything like you'd like to add to that? This is kind of one of those questions that, since I'm on the board and I work there for you, the board's a lot more aware of what we do at Garland PD because of that connection. But if there's anything you'd like to add to that?
No, I think these guys covered it. I will add one thing. If the group does not know this, in the North Texas area, the area chiefs, we meet once a month. So once a month, I eat lunch with Frank and Ed and all the other chiefs in the area, and we talk about issues. And this is one of the issues we talk about. So I do want to point out that we have discussions like this, but this information, we're sharing with the bigger group. But NAMI has been a big support for us. Todd has connected a lot of people using this group and other groups. The number one thing that we need, though, I think, is beds and resources that we can deploy. Another big problem we have is people reaching out to us saying, I've got this issue. And we had one yesterday. Todd and I dealt with one yesterday. I've got this issue with a family member, and we don't know where to go. And so providing that informational resource, we're able to do that, but providing that helps as well.
Chief Drain, is there something like you guys are doing in Plano? I know Nicole's sitting here too, so we know a lot about the good work you guys do from Nicole, keeping us up to speed. But if there's something you'd like to add to that too, Chief?
Yeah, and we're fortunate to have Nicole for many years now, helping out with some of our tougher cases, and once they get out of the hospital, and making sure that they're taking their meds and they're staying on their treatment plan, and she's been a big help. But we've also designated 2 of our officers as mental health / homeless officers. Again, to try to deal with some of the tougher cases out in the field, to free them up from other types of calls for service. We have no, we realize we're not going to be able to cover all of our mental calls for sure. But again, we're going to try to have them focus on that. And then if we can have some measurable success, we may try to expand that program going forward. So that's probably the biggest change that we've implemented in Plano over the last 90 days or so with dealing with mental health and homeless issues. And again, we're hoping to have some counselors we can put in the cars with those officers if we're able to get this grant award that we put in for.
Awesome. Yeah, we're really impressed with Nicole at NAMI North Texas. She's got a really good skill set. She's definitely got the things you can't train, the heart and passion for it. So we're really glad she's on the board of directors and helping us out. She really helps out a lot with what we're going to do, what our programs are going to look like, and what are some good ideas for them. So we're really glad that you loan her to us.
Oh yeah. Well, one of the things, especially with sometimes counselors and cops, don't mix, and Nicole's kind of in the family, when we hired her, and so she knows how to. Because it doesn't do any good to have someone like Nicole if the cops aren't going to go and go talk to them, and they don't mind coming to talk to Nicole about issues because she understands how they think and she understands from the mental health side too. So it's been a good partnership for us for sure, having Nicole on board.
Yeah. Hey, Terry, what in McKinney? So you're not just going alone. Have you found any partners or anything yet that can kind of help take some of the load off, or what are you guys doing?
Actually, I do a lot of referrals over to LifePath and try to get people connected to the local resources. So I have, we have Changes, McKinney. We have, of course, the Medical City McKinney Pavilion that's now open, and we also have LifePath. So I do quite a bit of referrals over to LifePath and working with them both on mental health and substance abuse.
So before I hand it over to Nicole, just like one of the things that I want to reiterate that we can do at NAMI North Texas is, especially with homeless services, is like for even out McKinney, Plano, doesn't matter really, anywhere in North Texas, we can help link you to different homeless service providers that do street outreach. And I don't mean just send you the website or something. I'll send you the phone number to one of the people that we partner with in Garland. So you'll be able to talk to somebody right away. You won't have to go through their website or anything of that nature. And obviously some of their capacity is limited because the need is so great. But once we started partnering with some of them, say like Metro Relief or our calling, and we were doing the intelligence, telling them where some of these persons that are homeless are living or staying, or where a quote camp is, we do the intelligence work, and then they come out and take over and do like the heavy lifting to try and get them into a shelter, whatever's next. So that's something that we can help you guys with being like kind of the liaison there. But without any further ado, I'll hand it over to our other moderator, Nicole.
All right, thank you. And I just wanted to also briefly introduce Sergeant Heasley, who also just joined us. He was with Chief Drain, but he is the new supervisor over that unit that Chief Drain was talking about, with the 2 officers doing mental health and homeless outreach. And then also I am part of that unit as well. Okay, so for our next question, we of course are aware of all the training and resources that are available for officers, but if you could share with the group what resources as far as training or education are available for law enforcement officers that have to interact with our mentally ill or homeless populations. Chief Dixon, did you want to start with that one?
Sure. So we don't have nearly the amount that we need, right? We have the basics, that the state mandates, and we have some that we can find at other places. I think what's important for us here, because we haven't had a unit like this before this far, and we're kind of detached from the rest of y'all, it's really hard to link up services for any kind of consistency or standardization. But I think that's one of the discussions that we need to have, and Elisa and I have actually been talking about that, is how can we go through NAMI in conjunction with NHMR, so we're all kind of following the same training protocol, so we know that we're staying consistent. So if we have a bad outcome somewhere in North Texas, we can all kind of speak in solidarity behind the training that went into it. Instead of now, you know, there's so many providers out there, you don't know which one of those trainings is going to be really beneficial versus those canned trainings that are just being thrown out there. So everything from specifics to dealing with veterans with mental illness, because they're completely different than someone that's suffering mental illness because of substance abuse. Completely different triggers, you know, everything about it. So I think that's important for us to focus on as we grow our unit here.
Terry or Russ, did you have anything you wanted to add about the education piece?
Well, ours, yeah, we're kind of like Chief Dixon said, we don't have, you know, probably near enough training, but ours is pretty much just communicating with our patrol officers. We have them constantly asking us questions, you know, and just trying to pass on information through them on how to respond and how things should work. And we just try to communicate with them as much as possible to try to address any issues and guide them in the right direction.
I know that NAMI has, for a long time, been really involved in the CIT training, which is the 40-hour mental health training for police officers. Are any of your agencies offering anything beyond that 40-hour training, any sort of maybe elective training that officers can take, or any sort of mental health refreshers?
I'll say we do the CIT training for all of our officers, but finding that extra training, Todd's done great at bringing some in. In fact, some that we've specialized just for our groups and especially for our crisis intervention folks. But to find that training, that's what's difficult for us in law enforcement. CIT training you can find, but if you want to go beyond that for advanced training, where is that and who is that, I think is a challenge for us.
Yeah, Nicole, this is Chief Drain, and of course we're fortunate to have you on board that you can help with training. Since we are CALEA accredited, I'm sure some others on here may be as well. There is a CALEA requirement that we have to do updated CIT training, but as the Chief just said, though, it's still along the lines of CIT, so it's more of a refresher. I wouldn't say that it's a more advanced training. So that is a gap that I think that hopefully eventually we can fill. But we do have ongoing refresher training on CIT as a part of our accreditation process.
So, yeah, and that is something that I have noticed too, just trying to find that training, but also find a quality entity to provide that training, because there have historically been some poorly put together classes, and we definitely don't want our officers getting incorrect information or getting just a canned read off the PowerPoint kind of training. So hopefully, as we all kind of expand our programs, we can come together and maybe vet some resources or come together and provide training for one another. Definitely something that I think we're open to in Plano. So,
Nicole, can I add something as well?
Yes.
I think the CIT training is good training. And if you look at the way our officers interact, I think they do a good job. Yes, there is additional training that's needed and more advanced training that's needed, but the officers, especially in the North Texas area, do a good job. It's just once that subject is talked down, now what do you do with them? And now where do you refer them to? And then tomorrow we're seeing them again. That's our biggest challenge. Training is great. We need more of it. I think the guys and the officers do a good job. But those follow-ups, that ongoing treatment, that having a place to put them, that's the wall that we are constantly facing.
Yeah, we feel that in Plano too, that lack of resources, lack of appropriate resources. If somebody is not necessarily meeting that inpatient level of care, but they're not able to go, not able or willing to do outpatient, you know, we just don't have a lot of resources for those individuals either, along with just a lack of beds, period. So I think a lot of that goes back to the funding.
Nicole, if I may interject, after hearing you guys' answers, I guess I'm curious as to what's the selection process for your, you know, specialized, like, you know, allocated resources, like, so for the individuals that are kind of being deployed, you know, to these crisis situations. So how are you able to determine who to select based upon, like what you're saying, everyone's getting like this basic training? So what's kind of like the criteria as a chief that says, okay, I want to put this person on the specialized unit?
So do you mind if I take that one, Nicole?
Yeah, go ahead.
So in our selection process, well, first of all, any patrol officer in the city of Plano receives this 40-hour training. And so in theory, anyone who's dispatched to a call should have at least have gone through that course and have been exposed to those concepts. So they should, if they make the decision to utilize the de-escalation tactics that we teach and the communication and the slowing down of the interaction, they all have those trainings. As far as the two officers that we selected to fill the unit, they made our job very easy. But what went into it is, you know, obviously I reviewed their previous work, got recommendations from supervisors, but I actually went in and I watched probably about 3 hours of video for every single applicant we had. And I wanted to see how they talk to people. And it was on calls that they may or may not have expected me to review. But I wanted to see where they're, you know, how they communicated with people in crisis. And then I also was very, very specific on my interview questions. It was not, why do you want this job? It was, here's a problem. How are you going to think through that? And how are you going to come to a solution based on the information that we're giving you? So I needed to know their critical thinking skills. And then we also placed heavy emphasis on how they interacted with people.
For us, we went a step further. When we had our boards, we brought in, they were mostly external. So we had our mental health court judge on, we had our city magistrate on the selection panel. We had someone from, actually two people from MHMR on the panel. And we only had Elisa, who's the supervisor, and then we had our accreditation manager that was on there too. But the bulk of the interview panel were external to the police department at all, and they specialized in mental illness. So those practitioners were able to ask them questions structured around, one, their desire to do it, their knowledge and what they had right now, and then some, you know, things to speak to the heart of why they wanted to do it. And we were really pleasantly surprised when we interviewed officers for those positions. The 4 that we selected, it was really easy. Speaking to what Sergeant Heasley said, it was really easy because they came and spoke from their heart, and we knew that the passion that they had was truly for this. And the pushback that we got, or that I anticipated, it didn't happen at all.
Yeah, and for our board, we had the division commander and the lieutenant over the unit, and then it was me, another sergeant, a peer, one of the officers that they would be working with. But it was also very important to me to have Nicole on that panel, you know, for a variety of reasons. But I think she has, you know, a very good perspective. So I think that's important, Chief Dixon, like you were saying, to have the outside she's not an outside, she's in our family, but to have the non-police officer perspective, I thought was really important.
Yeah, and when you sit on these panels, you know, that was my first experience with a panel or board interview like that. Out of our applicants, it was very easy to see who was actually going to have a passion for this population and be able to critically think through those things, be able to de-escalate, but also to be an officer and practice enforcement when necessary. So there is a process in place, but there is also, you definitely have that gut feeling of who is going to perform well in those roles. At least that was my experience for this specific position. Terry or Russ, did you guys have anything to add on how you select or how you might be selecting your clinician for your future position?
At this point, we don't know anything. I know just in our unit, and I was the one that started the unit and wrote up the policy and put all the plans in place. And then as they started seeing the numbers that I was dealing with, and that's whenever we brought another position and brought Russ's position in. And so it just continues to progress from our numbers growing and what we need to do to serve the community. And so we just keep adding to it.
All right, thank you, everybody. Do you all feel like there is support and awareness from the state of Texas in assisting with our homeless individuals and those that also have mental health conditions?
Yeah, Nicole, this is Chief Drain. I think over the last 7 or 8 years, I think our legislature has done a much better job of funding mental health. 10 years ago, we were probably number 48 out of 50 states when it came to funding on a per capita basis. Obviously, we're still not where we need to be as a state, but we are doing much better. And I think it was maybe 2 sessions ago where they put some additional funding in with House Bill 13 and some other things to really help out with mental health. So are we where we need to be? No, but we are much better than where we were, I would say, even 8 years ago as a state.
And I guess we've kind of already started touching on this, but have there been areas, other areas of the country where you all have noticed particularly successful efforts when it comes to law enforcement agencies addressing the needs of the homeless population?
The one that sticks out to me is, I bring this up, I can't remember, I want to say it's Anaheim, California. They did a case study on how they handled their approach. And what they did is forgive me if I'm saying the wrong city, it's somewhere in that area of California. But what they did is they documented every single thing they did, and they made repeated contacts, which is something that, most patrol officers aren't going to take the time necessary on each contact to learn the story of the person. Everyone has, a reason why they're there, and it's a story. And a lot of the components of that story are going to influence how you approach that person. No 2 approaches are going to be the same, probably. So what they did is they figured out the story, and they figured out, who may be likely to accept services, who may not be likely to accept services, but they were persistent. And of course, we know that one of the challenges for a lot of homeless individuals is they probably don't want to be there, but they also maybe have other reasons for why they're there. But it's very embarrassing to talk to somebody who's wearing a police uniform. It's very visible. They know, even if they're not in trouble, it's uncomfortable. So for us, we really rely on neighborhood services too to help us. But in this city, in California, they were persistent, and they finally were able to earn the trust of some of these individuals. And it just over time, it just contact after contact, where we're not here to enforce every single thing that you're doing. We're not going to scratch the ticket for every single violation you're committing or whatever. Because if you do, if you begin the enforcement piece, you lose the credibility that you've established. So one of the major successes that this city had was they had an encampment that was basically on a city, like right next to a city park, or actually it was within a city park, but it was right next to a major roadway, and it was well hidden. There were a bunch of trees and a bunch of stuff, and so they provided notice. They said, okay, you know, you have to leave by such and such date, and they returned on that date. And when they returned, they brought everything. If you needed to get support with housing, they had somebody for that. They had somebody from the medical team. I think they had, I don't know if it was their fire department or a doctor or what they had, but they had somebody for that. They had somebody to get them set up on benefits. They had somebody to get them, if they were a veteran, get help with veteran specific, but they had a long line of every single type of resource you could use. And again, they documented it. So there was no like, you know, if a city councilman were to, you know, hey, why are you picking? No, we've really tried over a long period of time to work with these individuals. And then after that, if they did not accept the services, which it was a small percentage that didn't accept the services, then it was, okay, you have to leave the park or you're going to go to jail. And so it was the very last thing they did was bring that enforcement piece in. That's the one that really sticks out to me as a success story.
Okay, yeah, thank you. Chief Dixon, I'm kind of curious, because you're starting this really huge unit for mental health and homeless outreach. Was there any other departments that you looked at as a success story to model your department's unit after?
I looked at a couple throughout the state and across the country. So I looked at what Amarillo was doing, San Antonio, Houston, and I looked at the Cahoots program up in Eugene, Oregon. And then I kind of combined facets of each of them, being getting a clinician in the car with a police officer, taking the uniform out of it. Our officers are going to be plain clothes with the clinician, which is going to be kind of a twist to how most agencies respond to it. Because understanding that the uniform in and of itself really brings another level of anxiety to consumers, especially when they're in crisis. So if we can, from the very onset of us going on scene, lower that temperature some, with them not having to look at a uniform and seeing two people, we're hoping that that can help them connect in a more relational manner. So then that follow-up becomes more consistent, and it's a lot easier for us to keep them on a program and you know, keep those repeat calls down.
When we were at CIT International last year, the Cahoots team did a presentation that I went to, and I was really impressed with their program. I think in our area, we're going to see some more successes when we can when it's not the police leading the way on the efforts. We have to get the community involved. And that's why in our agency, I'm on the phone with Neighborhood Services. That's the agency that helps us with the homeless outreach. I'm on the phone with them all the time. And actually last night, they had been unable to respond. Sorry, a train's going by. They had been unable to respond in the field because of COVID, but we identified an encampment. They really needed to respond. And so, you know, finally they went out, and the civilians were the face of the response, which was excellent. So I really like the Cahoots team. I see more and more agents, especially in this climate, more and more agencies doing that kind of approach.
Yeah, so are you all seeing, I guess it sounds pretty obvious, but seeing more success with those departments that are able to bring a non-law enforcement partner out there and have that person be the face of the intervention, where police might be stepping back and providing more of a security role?
I think that co-responder model has been working very well. Houston PD has a really robust program because they're so big, and they have so much, you know, so many resources. And they have a good success rate with theirs for that very reason, which is one reason we took kind of a hybrid approach to it.
Yeah, and I would agree with Chief Dixon on Houston. I mean, especially for an agency their size, they are well ahead of most police departments when it comes to mental health, because they have such a good tight relationship with Harris County as well. And in fact, when I was in Amarillo, that's when we decided to start training all of our uniformed officers in CIT instead of just a little small element. That's who we brought up to help assist with some of our initial training with some Houston PD officers. But we did go have the co-responder model in Amarillo, as I mentioned, and we thought it was quite effective. And regarding who took the lead depended on the type of incident you have. So in some cases, it was clear the police officer was going to have to take the lead because it's a more volatile situation. But if not, we would. The goal was to allow the civilian to take the lead and kind of be the face of that team where they could. So that was kind of the plan.
So I guess our next question is, how do you view the importance of a partnership between homeless services, law enforcement, and mental health organizations such as NAMI Texas? Chief Dixon?
Well, it's crucial to the success of in your community overall, right? No one part of that can do it by themselves. It's been proven over time, which is why we're here today. Law enforcement can't be the answer to it. The community doesn't have the resources in and of itself to do it alone. And our resource partners and the professionals in it, such as NAMI, NHMR, they also can't do it alone. So we have to all work together for it to work. And I think if you get everyone connected and moving in the same direction, because what we're finding here locally, we have more nonprofits than I could even name in the next 5 minutes here, all doing kind of interrelated work, but all wanting their name to be first on the line of anything that happens. And that is just crushing us from moving forward, because everybody's doing it for the right reasons. Everybody wants the same thing, but at the same time, they want the recognition that goes along with it. So I think if we can get past that, we can really take off when it comes to doing some long-term sustainable things.
Terry, I know that you've been involved in like the Collin County Homeless Coalition for a while, and some of these other groups in Collin County. How have those relationships helped in your work doing this outreach to mental health and homeless individuals?
That's actually helped quite a bit. We actually have a homeless outreach organization here in McKinney that does a morning breakfast Monday through Friday. And we try to stop by there, and so that we can kind of talk to the homeless and they get used to us being around. We hear their story, they hear our story. So we work closely with them. We've also reached out to the Wellness Center, whether it's the Wellness Center for older adults there in Plano, and we've had Lee Stark come up and meet with us, and he's gone out with us to speak to a couple of the homeless people there. So, and this is, when COVID came in, then everything just kind of slowed down. And now we're just finding the organizations that can reach out, that we can talk to and that can work with us, because we don't have the uniform on. We got the polo shirts and the 511 pants, and we were in a squad car that had all the lights and sirens and everything on it. Now we're in a smooth car, which really made it much more easier to connect. But yeah, we're slowly getting back into the groove where we're getting in touch with organizations that are able to come out and help us.
Yeah, I think that's put a damper on everybody's efforts to do that outreach. It's very hard to reach our homeless residents of our cities when you can't meet face to face, and our service providers are very limited on what they can do right now. So that's presented a whole new set of unique challenges for us all to try to work through. And I noticed we're a little bit past the time we had set up for this, so I'm gonna just jump ahead to kind of wrap it up. How can NAMI assist your agencies in your efforts to reaching out to folks that are homeless, that have mental illnesses?
I can tell you one thing that would help us greatly is just having the phone numbers of the people or the contacts for those people, so that if we and find out what the people from NAMI individual, what different branches of NAMI are there and what all's out there and who we can contact, because that's something, in order to have that immediate connection. You know, we're not having to look for anybody or anything like that. Just being able to get in touch with a person, having an immediate connection that can do immediate follow-up. Because what we run into is, if there's too much of a lag time, then we may lose contact with them, which, you know, they may pop up 2 months later and we're still right back to square one. But just being able to have that information, knowing who we could contact immediately to speak to that person, whether it's on the phone, whether it's through Zoom, however we can get that connection, then that right there is what's really going to help us.
I can just jump in right there and say, I'm happy to give you all my cell phone numbers and you can contact me anytime. One thing that we've done, I believe Garland and Plano and a few other law enforcement agencies have the cards, but we have developed cards that all of your police officers can carry with them that have our contact information and has just a little excerpt of what we do offer as support services. If you would like me to send you a bunch of those cards, just tell me how many. I will get them printed up and I will have them sent directly to you so that your officers can have them, you know, a couple in their pocket. They're just the size of business cards. So that's probably the easiest way for them to say, hey, contact NAMI. But I will put my cell phone number in the chat box for all of you, and you are all welcome to contact me at any point in time, and I'll do what I can to get people connected with the appropriate services.
This is Chief Drain. One of the things I think how NAMI can help us, I mean, NAMI is an advocacy group, and you can help us by advocating, by being at on our homeless coalition, our Collin County Homeless Coalition meetings. Yeah, it is related to homeless. NAMI is mental health, but as we know, a lot of those homeless folks do have mental health issues. When we have budget issues going up or things going up before our city council, having NAMI get up and go speak for those issues that are on the agenda is very, very helpful because of your knowledge on understanding both homeless and mental health issues. So that's what I would like to see is for those things when we're trying to get resources, to have NAMI's voice at the table, helping to advocate for those.
Absolutely, and you have Nicole there, so you have NAMI's voice. But above and beyond that, I am happy to join any of the meetings.
Yeah, sometimes as employees, we had AD Paul a long time, Sergeant Paul retired. He was also a big, he was a member of NAMI. Sometimes employees can't do both though. They can't be an advocate, they can't come out as an advocate and as an employee at the same time. So Nicole's hands may be tied to a degree when it comes to that.
Well, and so Chief, I think you've got my email and phone number. This is Sherry.
Oh yeah, Sherry, I still got your number, got Joe's number. You guys are all good. Yeah, so
yep.
I get a hold of you. We need you.
Yep, any one of us can contribute. Sherry, myself, we can also find somebody else who is closer, and some, you know, if one of us aren't available, we can find somebody else who is for any meeting.
Thank you.
Chief Dixon or Chief Bryan, is there anything that you would like to add on how NAMI can help your organizations?
No, but I will add I'll add how much we appreciate what you have given us. You know, y'all have been a great resource for us. I know Todd works closely with you. I'll have to brag on Todd quite a bit. You know, we selected Todd kind of like everyone else selection process, but he has taken this unit and taken the direction that we've given him, and he has set all new standards, and using NAMI to do that is much appreciated, and I very much appreciate Todd and his work and his passion for this job. I'm sure y'all have seen that over the past few weeks, but we see it as well.
Yeah. Absolutely.
Yeah, for us, I think it's going to be a matter of connecting Elisa and Sarah with you all, because we haven't worked with NAMI historically here. I worked with NAMI in Central Texas quite a bit when I was there. So I know the benefit that NAMI has to bringing it into the police department. So I'm excited to see what's going to happen once those relationships start taking off.
Yeah, I know that we would love to, as a NAMI board member, we would love to meet the new teams. As any of you expand or create new teams, that's something that we're definitely want to be involved in. NAMI's a big supporter of law enforcement and mental health training and mental health outreach. Well, I do want to thank you all very much for giving us your time. I know you're all very busy people, and we definitely appreciate you having this conversation with us and providing this information to our board members. We did record this conversation so that we can share it with our board members that weren't able to be present on the phone call or on the Zoom. And that is something that we are looking at sharing with our membership, if that's something that would be okay with you guys. I think Athena's going to reach out to you all individually afterwards to make sure that it is okay to share before we go ahead and do that. Is there anything, Todd or Athena, that you wanted to add before we wrap up?
No, I really value all your guys' time. I know it's a 24/7 job, a lot of demands on your time. I really value it. And I think you'll see going forward, maybe even with some advanced CIT training that we can come up with and some 16 hours of peer-to-peer training that we can come up with to support, because officer resiliency is really important to us at Garland PD. I know it's important everywhere for our staff. I think you'll see that we'll be a good partner, and you'll see some results. So just, contact us. And when we have some new things rolling out, we'll make sure we get it out. We have a good network, that Lima network that Chief Bryan allowed me to create. We have a good network in North Texas. We've got 30-some agencies connected. And I think we have representatives from all the departments here that's part of Lima. So I just really appreciate your time. We went a little long, and I think we're on to some good things here.